Hello and good day. This is Breeauna Sagdal here with you on another episode of Daily Clout. Today I'm joined by Oregon State Senator Dennis Linthicum from Klamath Falls, Oregon. And Senator Linthicum is the other Oregon senator to have signed on to the call for a grand jury investigation into the willful misconduct of the CDC during the COVID-19 pandemic. Without further ado, Senator Linthicum, thank you for joining me. And will you please tell our audience a little bit about this call for grand jury investigation?
You bet. It's a pleasure to be here and chat with you. I'm glad you let Senator Thatcher go first, because I always have this habit of saying ladies go first. And so I'm glad to see she beat me here. But we together, the two of us, Senator Thatcher and myself, decided to pursue a grand jury investigation because the CDC and the National Vital Statistics System operators are federal agencies. And as such, they are required to comply with federal law, specifically the Administrative Procedures Act, known as the APA, and the Paperwork Reduction Act, known as the PRA, which has embedded inside of it a act called the Information Quality Act. And our contention and our allegation is that the CDC has misused their, violated their requirement to fulfill these, regulatory obligations. And it's a pretty big deal when you think about it, because the requirement for federal agencies, their information should be protected. For example, there's unauthorized or unanticipated or unintended possibilities when it comes to data collection and policy review and figuring out what policy should look like and how objective the policy is. Should it be disseminated? Is it accurate? Is it reliable? Is it unbiased? And unbiased is an interesting term when you find the federal government organizing everything in a unified direction. They're not organizing it for public health. They're organizing it for their own bureaucratic momentum, their own regulatory mandates and objectives. And so their dissemination of information, their modification of information, specifically in violation of the federal registry guidelines that come from the Office of Management and Budget, which require them to enter into the federal registry records for each year. 2020 is the year in particular where they've messed up on a large scale, where they did not allow public comment with regard to the information that they were suggesting would be a new rule or two. And in particular, the biggest rule that we see being abused is the guidelines for filling out a death certificate. The local medical examiner is now following guidelines which totally skew the COVID numbers for death certificates and make it look like it's much worse than it really is. As you know, there's 2.8 comorbidities for every COVID death on average. And that means you could have had a lifelong renal cancer, or for 10 years, renal cancer, been in and out of hospital, been in dialysis, who knows what. And then you get COVID in the last week of your life, and they attribute the death to COVID instead of making the claim that you died of heart disease, diabetes, renal cancer, and all these other comorbidities. So they have skewed the numbers purposefully, and our claim is this is willful misconduct by a federal agency.
Wow, that's a lot to unpack. Goodness. Is there one in particular document or one particular instance you had referred to guidance that was issued? Can you Can you explain a little bit more about that?
Well, yeah, for example, there's the National Vital Statistics System had a COVID alert on March 24th of 2020, and it was COVID-19 alert number 2. This is one of the rules for coding the selection of underlying cause of death with regard to COVID. And they make the statements within that. They write their notes and their highlights, and they say the death certificate should be reported for all decedents, in other words, people who have died, where the disease caused or is assumed to have caused or contributed to death. Now, does it cause the death? Is it assumed to cause the death, but wasn't really the cause of death? The cause of death was the motorcycle accident. Or did it contribute to death, and how much did it contribute? 10%, 20%, 30%, 80%? And so they're suggesting that all of those categories become causes, COVID, causes for death by COVID. And we think this is a poorly thought through policy issue and had significant impact on data collection and data integrity, which are things also that the Information Quality Act is designed to ensure. So, that's just one instance in our paperwork and documentation. We have many, many of those kinds of alerts that are quite obvious with regard to the potential negligible or impacts of, I guess my word, I said negligible, but these aren't negligible changes to policy. The policy was done in 2003 originally, or that's the book that medical examiners have been using all this time. And now, all of a sudden, in March of 2020, they changed the policy only for COVID. They don't change it for any other disease. They don't change it for heart disease. They don't change it for cardiopulmonary failure. They don't change it for anything. They change it only for COVID. And our allegation is this is willful misconduct.
My goodness. I remember seeing on social media, there were various accounts of family members saying, I lost my brother in a car accident and his death was determined to be COVID-19. This whole thing is a scam. And I remember, seeing that's, I believe when Facebook really started to ramp up their fact checking in and around that time. I'm not saying because of that by any means, but I do remember, Facebook really started ramping up its fact checking and silencing accounts like that. But if what you're saying is true, right, and it certainly sounds like obviously you guys have more than enough evidence to prove that, otherwise you wouldn't, be calling for this grand jury investigation. But that's incredible, and I'm just kind of mind blown at this point in time, because so if I'm hearing you correctly, and let me try and repeat this in something I understand a little bit better, layman's terms, if you will. So essentially, the CDC altered how death certificates would be reported for COVID-19 only, right in the middle, smack dab in the middle of a pandemic, which
right.
That was then used, right, to sort of give governors and now the president this emergency authority, which bypassed your powers as a senator, I'm assuming, and the legislative branch in general. And then on top of that, are you saying that they didn't allow like a time frame for anybody to know about this or comment on it? There was no time period for people to have a heads up or say like, hey, this is not a great idea? Is that essentially what you're saying right now?
Yeah, that's exactly right. The process typically goes like this. There's a rulemaking board or committee or whatever that would decide we would like to do this, and then they just provide justification for why they would like to do whatever rule or regulatory change they have in mind. And then they publish that in what is known as the Federal Register. And the Federal Register comes out daily. It's an enormous volume of all the things at the federal level that are going to be changed. And the reason they publish it in the Federal Register is to provide 60 days for comment. This is their proposal, their logic, their reasoning, their well-founded purpose, and that goes into the register. Now the public has a chance to see it and pay attention to it. I'm very familiar with this from my work in the environmental arena. I live in a rural part of Oregon that is ag-based, and we had the spotted owl and the spotted frog and the blue butterfly and all of these endangered species. And as the government is proposing to regulate your property with regard to the native butterfly that may be impacted when you plow your field next spring, they pay attention to this registry so that they can make comment, and their comment can be their reason for either adhering to the rule or their reason for complaining about the rule and saying, time out, this is a little too stiff. Can we, instead of keeping 500 feet from the stream, can we just stay 50 feet from the stream and utilize our property more effectively? Those are the kinds of things that typically go into the Federal Registry at the environmental level, at the CDC, at the communicable disease and prevention arena. This would be rules about how are we going to, is ivermectin okay? Is HCQ okay? Is vitamin C, increasing vitamin C or vitamin D or zinc intake on a daily basis a good idea for the public at large? And those are things we know. We know statistically that most individuals have lower than what would be preferred levels of vitamin D or zinc or vitamin C. And these are doctors and public health officials who are reviewing this data, making their comments, suggesting that's economically unattainable or that's perfect. For example, it may be good for everybody to walk 10 miles a day, but somebody's going to finally say, that's unreasonable. The average guy can't work his job, come home and go on a 10-mile run and continue his life as normal. This is a standard that is very difficult to attain, even though somebody may come up with a plan that says this would make everybody super healthy and strong. And so this is the place where these things get weighed out and people understand how important the item is, what the cost is, what the quality of that standard looks like, and what other kind of information the government might have or expect to use to attain better public health. The CDC didn't do any of these things that I'm describing. They just left it off the table and published the rule and put it in the hands of medical examiners nationwide. And it's a clear violation of their obligation to publish their models in the CDC. And the complexity of the models, the underlying economic regulations and how to attain that and what the cost of this is, all of those features are entirely missing from any of the CDC's documentation. So it's a clear violation. We think it's willful and we think it's entirely inappropriate.
Wow, that's incredible. Thank you for explaining that. Now, I remember I believe there was a Senate hearing, and Senator Scott Jensen, who's also a doctor, Is this what he was describing in that hearing? Is this what he was, do you know if this is what he was addressing? He was talking about, as a doctor, new guidance had come down, and all of a sudden he was being asked to fill out death certificates in a new way that didn't make any sense. Is that?
Yeah, and that's correct. These two, there are specifics with regard to the death certificate, the items that go on the causal line, the first line, and items that go on the contributory line, which would be the second line, and how you fill those things out. And so these are all parts of the document and the instructions about how to fill those out, that the CDC just jumped right into the middle of. As you said, they jumped into the middle of this, right in the middle of a pandemic. And they never disseminated any of these thoughts or their logic or their reasoning or their understanding or their purpose. They never disseminated any of that. They never asked coroners or medical examiners or physicians for guidelines with regard to these significant changes. They just did it. Boom, it's done. And because they did it like this, they violated federal law, and we're asking that they be held accountable.
Thank you, Senator. I certainly hope that you guys find what you're looking for in this process. So willful misconduct in and itself, as I understand it, during circumstances such as these, there is no liability for the CDC, manufacturers, the FDA, the government, essentially in a time of emergency, unless there is verifiable, provable, willful misconduct, and that is actually defined. And so I was wondering if you could maybe touch on that a little bit, because that would essentially create the ability to hold them liable. Is that right?
We've never been here before, so this is new ground for us, in much the same way that it's new ground to do forensic audits and review all the process of the November 2020 vote. We don't know what it looks like at the end of the day, because this is new territory. And I think the fact that this is new territory ought to cause the public concern. If we've had rules, we've had standards, we've had implied purpose for the CDC and their entire regulatory stance, and all of a sudden, in the middle of a pandemic or epidemic, whichever word you're going to use, they thrust in new changes that clearly skew the numbers. And it's clearly skewing the numbers because it's may have caused, might assume to have caused, or might have contributed to death. And all of a sudden we're saying, gather all those up into the same, bucket and use those to fill out your medical examiner form. And this is a clear discrepancy or change from what was going on for the 4 decades earlier. Specifically in 2003 was the last time the coroner's handbook was changed, but it had nothing to do with filling out a death certificate. It was for other purposes within that volume. And so our claim is they did this, and they did it knowingly, and that they've done it knowingly means they're willful, and that they willfully created this pattern of misconduct over and over and over again. This one that we're describing right now is just the easiest one to identify. But in our allegation, in our grand jury request, we have a whole series of them, and the public can see 25 pages of this information in the document called COVID-19 Comorbidity and Federal Law, a Historical Perspective. It's a peer-reviewed paper that comes from Dr. Henry Ely He did a fabulous job of doing research with a team of individuals who reviewed the dates and times and stamps for when all of these things happened. COVID-19, comorbidity, and federal law, a historical perspective. It's a PDF file out there, and people can read up on it. And this really takes the steam out, or the impetus out of, quote, the emergency orders that we see in all the blue states where governors have taken this kind of totalitarian dictatorship and started to run downhill with it. And I think it needs to be stopped. That's why we filed this petition.
Excellent. Thank you so much, Senator. I really appreciate your time today. Is there any updates or any additional information that you would like our audience to know at this time?
I guess there's two things to say. One is we've done this, and any legislator in any other state, you're in South Dakota, you guys could easily do it as well. You could use our information and repeat it, mimic it, edit it as you please, but it's worth putting in front of a U.S. District Court, because if this is being done worldwide, we see in Australia where the police and crowd control in Paris, and recently Norway, just yesterday, Norway said, by the way, we think COVID is no more dangerous than seasonal flu. And so we have these diverse opinions out there. The CDC's moral obligation is, one, to follow federal law, and two, to ensure the integrity of the information they're publishing and get different opinions before the rule goes into effect, not after the rule goes into effect. So that they've missed this boat, and they've done it willfully, and they've done it knowingly, means this is misconduct of enormous proportions. And we need, across the 50 states, individuals to get grand jury petitions together and make the claim that this ought to be investigated. Is it criminal? I don't know. Is it something that's punishable through criminal law or through civil law? We would let the attorneys figure that out, but someone has to start with a claim, and that's what Kim Thatcher and I, as senators in the state of Oregon, are trying to do.
Thank you. If we wanted to share that information, could we post that on Daily Clout for individuals to access and share with their representatives and senators on the state side only?
Any citizen, any jurisdictional, anybody who lives within a attorney for the United States of America jurisdiction, which there are 190 some odd of those, 198, I think. Any one of those jurisdictions, they all have grand juries, and you could petition that lead attorney to it's usually a judge, it's a district court, to file a grand jury petition and supply the information. If you have our formal grand jury petition, the PDF has links in it, as well as we have hard copy documentation that goes with it. Please put it on your website and disseminate it far and wide. People can also go to standforhealthfreedom.com, and Stand for Health Freedom has a page that they could just sign their name. Say, I, John Doe, would like to sign and encourage grand jury investigation. So you don't have to do the whole thing yourself. You can join with nearly 100,000 other people who have already signed up at standforhealthfreedom.com.
Excellent. We will absolutely make sure to put that up for people to access and do just that with. Thank you so much for your time. If I may, I have one more question. You briefly touched on Australia and other countries who are engaging in this very similar type of practice. This last week, the UN met in New York City, and discussions were held about future global policy. And from my understanding, you're advocate and large proponent for local government, I was wondering if you had thoughts, and I do understand that I'm asking you at this point for your opinion, and I'm kind of putting you in the hot seat. So if I may, what can you share with us, and what is your opinion on the now global coming together and potential for governance?
Yeah, I basically don't trust the UN. They do not have the American perspective at the forefront of their mind's eye. They've got these utopian ideals that occupy their frontal lobe, but these ideals don't have any practical or praxeological backing. For example, the very first item on their goals for the year 2030 is, which is only 8 years away, nearly. The very first goal is no more poverty. That's a wonderful thought. I love their thought, but they don't have any praxeological ideas for how do you actually get rid of poverty. You get rid of poverty through prosperity. So are there other goals, goals for prosperity? The second goal is zero hunger. Well, I would love too to get rid of hunger, but to do that, I need prosperity so that there's enough food and cereal and meat and potatoes in the cupboard for every family on the planet. And then number 3 is good health and well-being. Well, prosperous people are usually and more typically in better health than those people who live in abject poverty. And quality education is number 4. Well, that also comes from prosperity. When you learn how to read and write and you develop autonomy, you become prosperous. And that frees you from living in ignorance and allows you a pathway forward through education. And so all of these, they've got 17 of these goals, quote unquote, and all of these goals, they have these ideals, but every time they come to the microphone, they're not talking about prosperity. They're talking about slowing down the economy, slowing industry, slowing innovation, responsible consumption and production, or climate action, or lessening your impact on the land. You cannot grow enough corn on your land to feed both people and cows and cars. At some point, there's always a cost benefit. Should this food go into people? Should it go into meat production? Or should it go into automobile and cleaner fuel? Those are policy decisions that the UN never really sets out in front of, like we're talking about CDC not publishing their reasons, their costs, their benefit, the likelihood of achieving their goals. The CDC didn't do that for COVID, and now we're in a mess. And I don't think the UN has done a good job of documenting those things at the global level, let alone at the local level. Sustainable agriculture in your own community is far more valuable than this global initiative to grow corn to put into automobiles.
Senator Linthicum, thank you so much for joining us this afternoon. I really appreciate your analysis of what occurred this past week in New York, as I also appreciate you coming on and describing the updates and also the call for the grand jury investigation. And we will put up that information at dailyclout.io for anybody who is interested in taking a look at that, sharing it, disseminating it. And thank you so much.
It's great to talk. Thank you so much.
Thank you.